To go whenever you want.
All righty, we'll get started. Hello, my name is Jody Brockman. I'm an RN here at NKC Health in the Community Health and Wellness Department. If you are joining us today, you are here to listen to Dr. Tony Mendes in session one of his wellness series, Feeling Younger and Living Longer. So I know I'm excited to hear what Tony has to say. Um, Tony, he has his PhD. He is a wellness researcher, corporate well-being pioneer, and longtime educator whose career spans psychology, organizational wellness, and leadership. He began his work studying the psychology and physiological effects of exercise on heart health before helping AT&T launch one of the nation's early corporate wellness programs. Dr. Mendes later spent nearly a decade guiding innovations and entrepreneurship initiatives at the University of Missouri, Kansas City. Today, he brings his expertise in human performance, behavior changes, and personal well-being to learners seeking practical research grounded strategies for healthier and more fulfilling lives. So again, thank you, Tony, for joining us today, and I will hand it off to you.
Thank you, Jody.
Okay.
Good. Yeah, you covered some of what I because I was thinking people are going to probably want to know who this guy is,
Oh,
right?
sure.
What does he know about wellness? Uh, so I'll talk a little bit about that, but so good to have you all on this webinar today. And I've got some basic slides because this is a three-part series. So today I'll be talking in general terms about wellness um, and longevity. And then in the next series, next to the series, which is in February, we'll get more into the barriers. Why don't people live healthier lives? I'll start a little bit of that today, but we'll get more in depth in the February session. And then the third component will be on commitment. And I'll talk a little bit about my work in the field of commitment. But that third session is going to be dedicated to, um, helping people to understand different aspects of commitment and whether or not they are committed to whatever lifestyle change they're interested in. Um, so it's good to have you here today. I hope we don't have any technical issues, but you know how things sometimes work. Let me see if I can. We had this working great a minute ago.
Yes, we did.
Um, oh, here we go. All right. So, as Jody said, I got a PhD from University of Missouri in Kansas City in psychology, and back back in the day, probably before some of you were even born, I don't know, I would imagine. Um, I was really interested in this whole idea of the body and the mind interaction. So I designed my program really looking at what happens, what happens to your mind when you exercise, and how does your mind influence the way that you live your life? Um, that culminated in my dissertation, which was the psychological and physiological effects of exercise with heart patients at St. Luke's Hospital. It really was kind of a complicated study. And at the time, my dissertation committee, when I told them what I wanted to do, they said, no, it'll never work. That's impossible. Because what I wanted to do is look at physiological and psychological changes with heart patients that went through an exercise program. Physiologically, I was looking at catecholamines, epinephrine, norepinephrine, and cortisol. And then I had a series of psychological tests that the patients took. before and after a 3 month period. Um, Kind of interesting because what I found was that um, the effects of exercise are just absolutely incredible. What happens to your body, what happens to the chemistry of your well-being, and most importantly, what happens to your mind, your brain, when you're successful at exercising. So I could probably talk for at least an hour just on that one project, but I'll kind of leave it at that. So what happened actually, it was I was very fortunate because the very last day of my studies, um, at the end of my coursework there, I got a call from a friend of mine and said, I saw this article in the paper and AT&T is interested in hiring someone to conduct a wellness study here in Kansas City. And I thought, that can't be. I mean, that's kind of like my dream job. That's what I've been preparing my life for. Anyway, I went down, I interviewed for the job, and I got the job. So what that involved was doing a pilot study for a corporate wellness program called Total Life Concept. And there were two study sites. One was here in Kansas City, and the other was in AT&T headquarters in New Jersey. And, it took us a year to complete the study. We had a comprehensive wellness program. We had things like hypertension uh, control, cholesterol reduction, weight loss, exercise, quit smoking, weight reduction, and interpersonal communication. And it was very comprehensive. The results of the study were extremely successful. So, AT&T decided to expand it. This is when, just to give you an idea, this is when AT&T was Ma Bell
Yeah.
in 1983. So, um, so it really was very exciting to do that. And then after several years, I think about 5 years here in Kansas City, they decided to move me to headquarters in New Jersey as kind of an internal consultant on healthcare cost containment. So at the time, AT&T was self-insured, but their healthcare costs were going through the ceiling. Um, so I was, promoted, went out to headquarters, and uh, actually through my research there, I developed a program called Managing for Health. And it was really designed to help managers understand uh, the impact that a bad manager can have on people. And, one of the things that we looked at very closely was stress because a lot of people were going out on disability for mental emotional disorders. And, of course, the basis for that was they were under a lot of stress at work. And then we started looking at management styles, and we found that poor managers that were rated poorly on the annual survey that they sent out, were really causing some of that stress. So we developed that program. While I was in New Jersey, I taught actually the first course that I taught at Rutgers University. It was called Facilitating Treatment Adherence. This was for medical students and MPH students. And basically, it was looking at how do you get patients to adhere to healthy lifestyle? How do you get them to do the things that they have to do to not only deal with chronic illness, but, live a healthier life? So I taught that for a couple of years at Rutgers, and probably the favorite course I've ever taught at university. Um, while I was there, also, um, Irwin Professional Publishing contacted me, and because I was doing a lot of work with commitment. And I'll tell you a little bit more about that later in this session. But um, so they asked me to write a book on inspiring commitment, how to gain employee loyalty in chaotic times. This was in, the mid 90s, and there was a lot of downsizing going on. And so they wanted, what they called a briefcase book, something you throw in your briefcase and read on the train to work. Uh, so that was a publication I had in 1995 on commitment. And as I mentioned, the third of in this series will focus specifically on commitment. And, I sent Jody some of the commitment factors. Maybe what we can do, Jody, is before that third session, people that sign up, we could send them some of those commitment profiles so they could fill it
Sure,
out beforehand.
sure.
Okay. Yeah. So, so after, let's see, five, 5 or 6 years in New Jersey, uh, my wife said, "No, we got to go back to Kansas City. I can't. I don't want to live in New Jersey anymore." So we came back to Kansas City, and I started an organizational consulting company based on the commitment building. And I worked with local companies and also some national corporations on how to build commitment in organizations. Um, Kind of interesting. One of my clients here in Kansas City was the Kansas City Royals baseball team. They were having some executive issues, conflicts, and they brought me in to work with the executive team. And while I was working with them, the Kauffman Foundation that owned the Royals at the time, you may remember Ewing Kauffman owned the Royals, but the Kauffman Foundation became a client, and they, after just, I don't know, maybe 4 or 5 months, they asked me to come on with the foundation full time uh, to head up what they called collegiate entrepreneurship. And it was basically giving grants to colleges and universities for entrepreneurship. So I did that. I was with Kauffman for 7 years, and I went to the University of Illinois as executive director of a cross-campus entrepreneurship program there, and was there 5 years. And North Texas University wanted me to head up their entrepreneurship program. So I moved down to Denton, Texas, and then after a number of years there, I came back to Kansas City, and UMKC hired me as managing director in the entrepreneurship area. Um, and then I retired. I thought I retired. I tried for a couple of months, and I thought, no, this isn't working for me. And so, and some of you on this call may experience similar things where you you're not doing exactly what you want to be doing. And I decided, the thing that I loved the most in my entire career was when I was doing wellness work. And so I decided that's what I'm going to do. I'm going to be a wellness coach. And um, a couple of years ago, or a year and a half ago, I completed the Harvard Medical School lifestyle and wellness coaching certification program. And I thought I knew everything about wellness, right? How complicated could it be? I've been teaching it for years, but I learned a lot from this program. It was really very interesting to be up to date on some of the research and and being current on that. So part of what I do through my wellness coaching is to incorporate some of the new research and knowledge that we have around that. Um, so let's get into um, some things about wellness. One of the things that people ask me is, yeah, I want to live to be 100 years old. Okay. What does that take? And in fact, I did a presentation at UMKC for the students there last year. And, you know, I did some research, and what I found was that for a 20-year-old, they have an 80% chance of reaching 100. I mean, because of the research that we now know of, because of different technological innovations, things like that, it's definitely within their grasp. Um, so, how do we take that information? How do we learn from everything that's going on and apply it to people that are, our age or younger, to see if it's possible to reach that milestone? Um, So that's the good news that we've learned a lot, and it's very possible to extend your life. And we'll be talking in this session not only about life extension, but the quality of life. So the not so good news in the US, um, life expectancy is around 79. It's a little bit more for women than it is for men. Uh, But unfortunately, we're falling behind other countries by over 4 years. I think a lot of this has to do with lifestyle. If you look at the average American, their level of activity, their nutrition or lack of nutrition, um, it really doesn't hold up to some of the other developed countries. Um, and the other thing that's not so good news is living longer has drawbacks, right? So, do you want to live to be 100, but the last 10 years of your life, you're in misery? I was telling Jody earlier today about my in-laws who are in their early 90s, but they have not been good to themselves. They really did not have very healthy lifestyles, and now they're suffering because they have all types of chronic illness. So the goal really is not necessarily to live longer. It's great, but the goal really is to increase what we call your health span. Okay, so how do you really enjoy life uh, to the fullest? And that's really uh, what wellness is all about, and that's what my coaching is about. So I think about this great paradox. Um, so you may think about yourself, or you may think about people that you know that want to reach the golden years. Okay, time when you retire, you've achieved everything you want to achieve, and your financial goals have been met, uh, but you lack the energy and enthusiasm to enjoy the fruits of your labor. I mentioned when I was at AT&T, I was always amazed by uh, other managers in the corporation that they would have their 401k plans, their ESOP plans, and they were saving, for their retirement. They wanted to retire at 55 or 60. And I thought, great. So you're going to meet your financial goals, but what's it going to be like when you're older? I mean, are you going to be able to do the things that you really want to do? And what we know is that over 80% of older Americans have some sort of chronic illness. Okay. And these are people 65 and older when we talk about older Americans. 80% have a chronic illness, and over 50% have two or more chronic conditions. Um, so once again, when you think about this, a lot of people think, "Oh, well, it's my genes, my mother or my father, my grandparents, they had, that's it's a part of it, but that percentage does not compare to the lifestyle related factors that contribute to these chronic illnesses. So once again, um, And I know you're on this webinar to learn about wellness. That's what it's really about. How do you improve your lifestyle, even if you have chronic illness? How do you deal with that? How do you overcome some of the disadvantages of that and get back on a healthy track? Okay, as I mentioned, I get the question all the time about centenarians. How can I live to be 100 years old? Medical advancements are great. I mean, as I mentioned, sometimes a disadvantage because they can keep you alive, um, but is being alive at that point really, um, is it something you really want to endure? Um, the other thing when people ask me, okay, how old are you? It's an interesting question because there are three different ways of looking at it. One is your chronological age. Your age? How many years have you been alive? I mean, typically that's what most people say. I'm 65 or 70 years old or whatever. Uh, but there's another way of looking at it, and that's your health age. Okay. And your health age can be estimated by biometric testing. Um, I don't know if any of you have been to any of Jody's health screening that she has. I know she does one at Liberty Community Center all the time. And as part of that screening, she'll tell you, with a certain amount of accuracy, what your health age is based on your biometric information. In fact, I think they also at one point, Jody, had like a scale that you stood on that
Yes.
gave you your
Your
your BM.
biometric age, yeah.
Exactly, right.
Mhm.
So to me, that's much more important. I mean, I'd rather have a good health age than chronological age. Um, and you can be tested for that. And if you haven't been to one of Jody's evaluations, I strongly recommend that you try to attend that. A third way that's just being developed now is a biological age. And this is through DNA testing. I actually signed up for this a little over a year ago. What they do is they take a swab and they look at your DNA, and through different mechanisms, they can tell the actual aging of certain organs in your body. And it's really kind of fascinating. But again, it's a way of determining, how well your body is holding up through the years, and it's really kind of a fascinating. There's a lot of things online that you could look for determining your biological age through DNA testing. The other thing is to know about your family history of chronic disease. Okay. Um, so, for instance, with my family history, my father was diabetic. Um, my three older siblings, diabetic. And so that's something that, I've had to really look at. When I get my annual physical and my physician is always telling me, you know, it's a good thing that you exercise as much as you do and watch your diet because you don't have any signs of prediabetes so far. So it's something I work at because I know I may have that genetic predisposition. Um, with my mother, she had colon cancer. She had actually her first surgery. She had two surgeries for colon cancer. All of her siblings also died of colon cancer. So again, I'm like, okay, so what do I need to do about that? So ever since I was probably, I don't know, maybe, you know, for the last 25, 30 years, I've been really looking at my diet and being sure that I have plenty of fiber, and I've got a routine that I do every day regarding that. And I get my annual colonoscopy every 5 years, and so far I've had absolutely no sign of any type of colon cancer. The other thing that runs in my family is dementia. So my older siblings all had various degrees of dementia, and again, I kind of watch that. But so if you have heart disease in your family, if you have any of these chronic diseases, illnesses, you really need to get with your physician, be sure that you're being properly screened and evaluated. And you know, you know, if your physician is giving you advice on what you should do to improve your lifestyle, listen to him or her, and because that's key. If you want to really outlive the odds, you really need to think about lifestyle, and that's what we're going to start to get into now. Okay, the other thing about health and wellness, to me, it's an unbelievable investment. Probably the best financial investment you could make in your life. Um, I think about people that, friends that I have that are my age and some that are older, especially family members that are older, uh, cost a fortune. I mean, the cost of this information that you could find easily available. If you look at the cost of chronic disease, it could be over $57,000 a year. Um, Cancer treatment, over 25,000, and this is even if you have pretty good insurance first 3 months. Um, and then, of course, as you start to reach and need hospital care, this can also be very expensive. My in-laws are in assisted living, and they're paying over $10,000 a month uh, to have the care that they need. And so again, if you can avoid some of the chronic diseases that many people develop later in life, it could be a huge financial gain to avoid that. Um, but to me, the most important thing is what would you pay to have the energy and vitality in your latter years? Um, I was telling Jody, I spend my winters in Florida. I've got a place there, and sometimes I'll just sit on the beach and watch people walking by, and think, you could tell they're definitely extremely overweight. Huffing and puffing, just walking on the sand down the beach, and I'm thinking, what would that person pay to have the energy and vitality of someone younger? It's absolutely critical. So how do you look at this in terms of a financial investment or a return on investment in your life? To me, number one, belong to some type of a gym, okay? Whether it's a community center, a fitness center, whatever. A gym membership is extremely important. I mean, not just having the membership, because, as you can see, I've been teaching business for a good part of my career, and the business model of gyms does not. They don't want you to attend on a regular basis. Let's put it that way. If all of their members showed up to work out in one day, it'd be overwhelming. So they go on the assumption, which is true, that most people buy a membership, and they'll keep the membership, and maybe for the first month or so they might go fairly regularly, and then they just stop going. So having the membership is one thing, but making a commitment um, to exercise and get activity every day is the critical part. Healthy foods, I'll talk a little bit about nutrition today, but once again, you know uh, absolutely a very important part of your lifestyle. The other thing that we're finding, and I'll talk about this in our second session that we have, is social connections. I mean, uh, a lot of the researchers that look at longevity, they're finding incredible gains with people that have good social connections. I mean, upwards of 5, 7 years added years to your life if you have healthy social connections. So again, that's an important part of lifestyle, and we'll talk about that in some of the other sessions. Before I go any further, I think we might have some people wanting to chat. I don't know. I can't see the chat uh, thing up top. Do we have any questions? Anyone have a question? Let me see.
No, basically just comments, Tony.
Okay, okay, great. All right. But stop me at any point because I want this to be interactive. I'm going to probably go for another 10 minutes or so, and then just going to open it up to discussion because, I just don't want to be the one talking all the time. Okay. Moving. All right. So here are the building blocks for enhanced living. And I mentioned that I completed the Harvard Medical School certification in wellness coaching. And this is basically what they offer. I mean, you had to complete modules in all of these areas. Um, and this is, to me, the essence of a wellness lifestyle. Lifestyle assessment is the first thing that I do with all of the people that I coach. And in fact, I'll talk about, I think Jody may have sent out some links to some of you on how to do a lifestyle assessment, but I'll talk a little bit about that. Exercise, activity, you know, absolutely critical. And a lot of people, I'll talk about exercise because people get turned off just by the word exercise, but we're really looking at the benefits of having an active lifestyle. Um, Healthy eating, absolutely critical. The proper mindset. As I mentioned, I'm a psychologist. I'm a cognitive behavioral psychologist, and what I what I believe and what I found in working with my patients and with others in the field of wellness is if you don't have the proper mindset, you will never have the proper lifestyle. So how do you really gain that? How do you set yourself up so that you have that anticipation, you have the proper mindset to live a healthier life? Commitment to wellness. Again, I'll talk more about that in my work in the area of commitment. Dealing with medical conditions. Next session, we're going to talk specifically about that. Healthy stress. A lot of the work that I did in my wellness career, and actually in my consulting, my organizational consulting business, had to deal with stress. A lot of corporations would hire me because there was a high level of stress in the organization, and they wanted some strategies on how to help people with that. So I'll talk specifically about stress and what most people don't realize is there is a healthy aspect of stress. So we'll get into that. And then, of course, essential social context. And again, we're not going to have time to dive into that today, but we'll do that in other sessions. Okay, so as I mentioned, there could be a difference between your chronological age and your health age. In fact, I hope there is a difference. I hope that your health age is a lot younger than your actual chronological age. Um, so there is a basic assessment. I can click on that and show you, but I'm afraid if I do that, I may lose the PowerPoint. Should I try it? You think, Jody?
I'll go ahead, I guess. Yeah,
All
let's do it.
right, let's see. There it is.
Yeah.
So this is a lifestyle health questionnaire. Can you see it? Did it come up?
Yes, it did.
Okay. And it's embedded in the PowerPoint, but I can, if Jody can't send it to you, I can send it to you. Um, but it just takes you through an assessment, right? Um, your physical activity, your nutrition, um, your sleep. Sleep is so critical for healthy living. Your social support systems. It's really kind of very informative. And if you're interested in wellness, I really encourage you to download this and complete it. And I think, what it'll do is once you complete it, it'll give you your health risk and your health age compared to your chronological age. So with the people that I work with in my coaching practice, this is one of the first things that they do. They complete a health risk questionnaire. They also have to have a medical exam within the last 6 months because what the doctor sees in terms of biological indicators is important in planning a healthy lifestyle. So, again, this is just one instrument that you can use uh, to determine your health age. Okay, now let me get back to see if I can find my Zoom again. Hold on. I think I need to move this. Could you move that down a little, Jody?
Mm,
You're
I
moving something.
I
No.
can't move
Hold on.
anything. Uh-uh.
Okay, hold on. Hold on. Let's get back to it. Hang in there, folks. Oh, nope, that's not it. Yeah, this is what I was afraid was going to
Yeah, I
happen,
wonder
but
if you just close out of it and see
yeah,
what that does.
I'm trying to do. Here we
Yeah,
go. Am I back?
perfect. You are back
Okay.
in
All
action.
right. Back in action. Um, so there is another tool um, that provides an indication of how long you'll live. And once again, these are things that you find on the internet, and they're kind of they're fun to work with, even though you have to take it with kind of a grain of salt because it's not, there isn't an instrument out there that'll tell you how exactly how long you're going to live. This is a basic life expectancy calculator that gives you some, information. Unfortunately, some of these assessments that you take, they try to sell you something, whether it's a supplement or whatever it might be. So again, you can use it, but just take it with a grain of salt. But again, you're going to be interested in, you know, different kinds of factors, especially lifestyle factors, that contribute to not only how long you're going to live, but quality of your life. All right. So if there's one thing I could recommend that everyone on this webinar do, is to look up something called blue zones. Okay. It's really kind of fascinating. I've been looking at blue zones probably for, I don't know, maybe 15 years or more because they've been doing research with these communities um, for many years. So blue zones are places where people were living to be in your 90s and 100 really is not unusual, right? A lot of people, a high percentage of people live to be 100 years old. And so these are communities around the world, Okinawa, Japan, Sardinia, Italy. There's actually a place in the United States, in Loma Linda, California, uh, where people live long lives, Greece, Costa Rica. So, what we've learned about looking at these folks is that number one, they have a high level of activity. Remember, earlier I said, um, it's one thing to think about exercise, but it's probably more important to think about the activity that you have on a daily basis. So the people who live in the blue zones are always gardening, they're walking, they're doing a lot of things that really elevate their activity level. Um, and the key to that is movement. The other thing is they have very strong social relations. They take care of each other. They're in communities where there's a lot of social interaction. Um, all of them actually have what's referred to as Mediterranean diet, where they're mostly fresh fruits and vegetables. Many of them grown in their own gardens. So again, if you're interested, I would really suggest it's kind of fascinating just to read about some of these things. The other thing about activity is strength training. There's a lot more being done now in terms of looking at longevity. Uh, so the research on how strength training could actually be more important than aerobic activity for aging. So what that means is, having sufficient muscle development, muscle movement, and it not only contributes to your metabolic rate, your muscle tone, but also to your bone health. So people that practice strength training have really good bone health, bone density. And as you age, of course, that becomes even more important because you may know people who fall when they're in their 80s or whatever, and they break a hip or they break something. And so that's once again another reason to have sufficient strength training in your daily activity. So I'm not going to get into a lot of nutrition today. As I mentioned, there's a ton of information out there. Um, there is also a nutrition calculator that you can find on the internet. Once again, we can send this to you. But basically, what we're talking about are diets that are, uh, to me, they're healthy. They're healthy because they're natural. So fresh fruits, vegetables, beans, nuts, lean meat, and chicken, seafood. So, you have to have a sufficient amount of protein, but the protein has to come from a good source. Unfortunately, in our American lifestyle, a lot of our eating involves highly processed foods and fast foods, which lack some of the nutrition that we really need. The other thing that I look at are carbohydrates, and one of the things that I mentioned that I've got a morning routine, and with my cereal, I only eat cereal that has a 7-to-1 ratio. What I mean by that is a 7-to-1 ratio of your total carbohydrates to your fiber. So, and it should be a 7-to-1 ratio. So if you have, you can just look at your total carbohydrates and the amount of fiber and see if it's a 7-to-1 ratio. Monosaturated fats, olive oil, avocados, these are things that even dark chocolate. I mean, you can, uh, this really helps to minimize some of the adverse effects of using saturated fats. People ask me all the time about alcohol. Some of the research says that you can drink one drink per day or seven drinks per week. Um, to me, that's probably too high. So, and in fact, there's kind of a social movement right now where people are cutting back significantly on their alcohol consumption. So, again, there's all kinds of physiological effects of alcohol overuse and alcohol abuse, and something you want to really keep in mind. So, so what is the 80/20 rule? We started using this back in the wellness program for AT&T, and basically what we're advocating was that 80% of the time you stick to a healthy diet. Okay, you do all the things, you eat all the things you're supposed to do, and then maybe 20% of the time, you can have your chocolate chip cookies or your pie or whatever ice cream, the things that you enjoy because you want to enjoy your life as well. You don't want to have a strict diet where things that you really love are eliminated. So that's where I usually recommend the 80/20 rule. So the other thing that came out with the Harvard program was healthy eating. Now, some of you may be familiar with the uh, the food pyramid. The food pyramid hasn't been used in years, and it's been replaced the by two things: the Harvard plate and the American Diabetes Association plate. And they're basically pretty much the same, and you can see it here. Uh, so, healthy oils, being sure that you have sufficient water. You take in your vegetables, and you can see that's a pretty big slice of the pie. And fruits and vegetables actually making up half of your eating plate. If you think about a plate of food that represents your daily intake, this is pretty much what it would look like. And then with your healthy proteins, we usually advocate fish, beans, nuts. You limit your red meat and cheese, and then things to avoid like bacon and cold cuts. Um, so that really is the the eating plate that we recommend, and you can see, you know, the percentage of fruits, vegetables, protein, and whole grains. Okay, so we don't have a lot of time left, but I'm just going to briefly talk about your mindset. Okay, because now we're getting into a whole nother area of wellness. And to me, a healthy lifestyle starts in your brain. Okay, it all depends on how you look at yourself, how you look at your environment, how you deal with your emotions, your thoughts and beliefs and values. Um, so one of the things that I advocate, that I help people with, is to really look at how they interpret the world around them. Okay, how they see themselves. I mean, what is their motivation? Um, so people are motivated by different things. Some people, it's body image. I know um, when I was younger, for instance, it was really important for me to I wanted to look good. I still want to look good. Body image is important, but it's not the only thing. I mean, now we're seeing that, a bigger body, a heavier body doesn't have the negative connotations that it has in the past. So body image is something. To me, a more important motivator is your health. Okay, especially if you're dealing with a health issue. You want to, avoid those years where you're just you're miserable. You're tired all the time. You have aches and pains, and you have chronic conditions. So health could be a major motivator. But as I mentioned, and I'll talk a little bit about the research I did with that course I taught, um, uh, sometimes it's not enough for people to really change their lifestyle. Another thing could be competition. Um, some people are they choose a healthier lifestyle or they live a healthier lifestyle because they don't want to be like someone else that they see that's aging maybe too fast and too soon. Okay, very quickly, I'm just going to go through some of the things that I found in working with people in the wellness area. Uh, so these are some of um, the negative mindsets that get in the way. The first is denial and procrastination. Okay. And I've seen this, I've heard it so many times. It's really not that bad, you know. My father smoked until, he smoked for 50 years and didn't develop lung cancer. It's always something that won't happen to me. Okay. The other part of it, procrastination is time. I'm so busy, I just don't have the time. Um, and again, this is a mindset. This is something that prevents you from doing the things that you know are in your best benefit. Another thing that I've seen is discouragement. People that say, "Well, I've tried it before, it didn't work, or it didn't last." Especially people that I worked with in quit smoking programs where, oh yeah, I quit smoking before, but I was nervous all the time. I couldn't sleep. I couldn't go to the bathroom, blah, blah, blah. So they build up this negative expectation of quitting smoking, and that was a major part of their discouragement. Some people are oppositional. And what I mean by that is, and you may know people like this in your life, you tell them one thing and they'll do just the opposite. Okay. I'm not ready. I'll do it when I'm ready. Or don't tell me what I should be doing. So people that are oppositional take a very different approach in helping them to modify their lifestyle than people that don't have that oppositional mindset. And then the last part of it is externalized perspective. And this is where people, and you can hear it, right? People are always saying, well, if it wasn't for this, I wouldn't be like this. If this would only change, I'd have the time to exercise. If I only had the money, I could afford healthier foods. So it's always the external environment that is determining whether or not they're able to live a healthy lifestyle. And again, that's really a negative mindset. I think I have one more slide, and then we're gonna just okay. This is the last thing I want to talk about because I used this when I worked with heart patients in my dissertation. The first, this is locus of control, and once again, there's an instrument that you can take. You could probably find it online. It's called locus of control, and it determines whether your internal or external locus of control. People that are external locus of control are looking at the external environment to change so that they can feel better. Okay. Um, and what I found with the heart patients is once they started exercising and felt good about that, it increased their internal locus of control, which means they had more of a perception that, hey, there's something I can do. I'm doing this and it's working. They're not relying on the outside environment to change until they feel better. And the second part is self-efficacy. And that's the belief that I can control my situation. And as a result, my lifestyle is better. Again, people that take those small steps to try to improve their lifestyle, it builds on that confidence and it also builds their self-efficacy. And there's another link here where you can actually take the locus of control test. So I know we only have 5 minutes late. I'm sorry I talked so long. I don't know if we have any questions, but I just want to open it up.
I have a question, Tony, about
Yeah.
your 7-to-1 ratio. What are your thoughts of adding either chia or flaxseed to
Yeah.
increase
Well,
that
I'm a
fiber?
huge fan of flaxseed. In fact, I
Okay.
on my cereal every day, I put a big heaping teaspoon of flaxseed because I have that family history of colon cancer. And as a result, I mean, I'm not going to get into details, but I'm extremely regular. I mean, it's
Hmm.
like clockwork. So I am a huge fan of flaxseed meal.
Okay.
Absolutely.
And if any of the other participants have any questions, feel free to pop them
Yeah.
in the chat. We can hit Tony with any questions that you might have. And I will send that link out, the health risk questionnaire to everyone, so you can
Okay.
get that done prior to next month's offering, which is on February 12th. And you can sign up just like you signed up for this one online. And then the third wellness series is going to be March the 12th.
Good.
Yeah, a lot of info.
Perfect. Well, I really appreciate you being on this uh,
Mhm.
Zoom today. Um, and again, if I don't know if you have did I give you my email address?
I have
Um,
your email address. I can share that with them if you'd like.
yeah, absolutely. So
Yeah.
any questions, I mean, just shoot me an email.
Hmm.
Um, if you know, just to stay in touch, or if you have any additional questions, or if you need some of the links that we've talked about today, just shoot me an email and I'll be glad to send it to you.
Yeah, that's great. And regarding when we're going to be doing biometric screenings in the community again, we do biometrics very often, meaning cholesterol, blood sugar, blood pressure. We're somewhere at least 2 times a week. And you can find out where we are by going to our website. But for instance, the bigger events, we're going to be at Parkville YMCA January 23rd from 9 to 11. So that's usually a big one, and we'll try to have the biometric scale with us that day. And again, that's the scale that will kind of tell you what your biometric age is. So not necessarily your age, but kind of what your readings on that scale indicate your biometric age would be, and also some tips to improve that if improvement needs to be made. So hope to see you guys at that. That would be kind of fun to run into you in the community. So it doesn't look like there are any other questions. So
Okay.
thanks
Well,
so
thanks
much.
again.
Yes, and
Thanks, Jody.
like I said, I'll send out that link to the health risk questionnaire.
Yeah,
And then after this webinar is done downloading, we'll have a link and it'll live on our YouTube page, our NKC Health YouTube page, where you can find just a plethora of great information regarding health. So that's what we're here
perfect.
for. All right. Thank you very
All
much,
right.
and everyone have a
Thank
great
you.
day.
Okay.
All right.
Bye-bye.
Bye-bye.